Ms. Miller, you're recognized.
Thank you, Chairman Buchanan. And thank all of you all for being here today. And Senator Frist, it's nice to have you back. Thank you for taking your time to be here, to help educate us and to testify on such an important issue. It's extremely personal to me and my constituents because I'm from West Virginia. And West Virginia has the highest rate of diabetes, COPD, and kidney disease in the country. Mm-hmm. This is nothing to brag about, but it is something that constantly guides my work and the work of healthcare providers in my home state. One effort that I've been very impressed by is the Food is Medicine program at Marshall Health Network that's in my own hometown of Huntington. The Food is Medicine program screens patients for food insecurity and social needs, provides medically indicated food assistance, and encourages nutritious food utilization. And this approach to chronic disease management has been working wonders for patients in our state. There's a medically indicated food box program in the little tiny town of Lavalette, which is led by a community health worker, and it recently showed that all 61 patients participating in the program have gotten their blood pressure under control. Similar food assistance programs provided to dialysis and oncology patients with food insecurity have improved nutrition and outcomes as well. Dr. Hyman, you've dedicated your career to the notion that food plays a huge part of managing chronic disease. Can you speak a little bit more on some of the benefits of getting patients on track for healthier living?
Well, it's quite astounding. You know, I've been practicing this way for 30 years, and I would say that food is the most powerful tool in my toolkit as a doctor for a broad range of diseases. Obviously diabetes, but many other things. Mental health, we know, is directly related to diet. That ultra-processed food has been linked to depression, anxiety, behavior changes in kids and adults. We know from clinical trials, for example, in other countries where they swap out healthy food for the junk food, that depression rates are dramatically reduced. We know for autoimmune diseases, for neurodegenerative diseases, for example, dementia, which is one of the most costly diseases because of the effect on caregivers and loss of productivity, is now called type 3 diabetes because of the effect of insulin resistance and sugar on the brain. So across the spectrum of chronic disease, not just the ones we typically think of like heart disease and diabetes and hypertension, but even cancer is primarily driven by sugar and starch in our diet. The main cancers, colon cancer, breast cancer, prostate cancer, pancreatic cancer. And these cancer rates are rising. We're seeing the younger and younger members of our population, 30, 40-year-olds.
Repeat that statement right there.
We're seeing cancer in younger and younger people in our country, which is staggering to me, in their 30s and 40s.
Yes.
And the real driver is our diet. And until we come to terms with this fact as a country, we're going to not only threaten the health of our nation, we're challenging our economy of the $4.9 trillion. 40% of that bill is footed by the federal government in one program or another. It's 30% of our federal budget. It's completely unsustainable, and most of it's almost preventable. So if we tackle this intelligently, coherently, and looked across the policies that have to be done, as Senator Frist said, across different committees, across different jurisdictions, whether it's Medicare reform, whether it's food labeling, front and package labeling from the FDA, or addressing the problems of food marketing to children, or addressing the problems with SNAP, or looking at our dietary guidelines or nutrition research funding. There's so many levers to pull as we try to change this tsunami that's coming at us. And it's almost been this invisible threat because when we graduated medical school, this wasn't a problem.
No, it wasn't.
I'm old, but not that old.
Well, I think I'd like to move on a little bit as well, because chronic lifestyles in patients, we also need to listen to the clinicians because they have a big role to play here, just with screening and education, and identifying the chronic diseases and how to manage them.
Yep.
Studies have overwhelmingly showed us that the screenings for diabetes, cholesterol, chronic kidney disease, and cancers can be the difference in anybody's health journey. I introduced a bill called the Chronic Kidney Disease Improvement in Research and Treatment Act to address these issues just for kidney disease, and my bill would expand the Medicare annual wellness benefit to include kidney disease screening for seniors, as many patients do not know that they have kidney disease until it's too late. The bill would also increase access to the Medicare kidney disease education benefit so that physicians, as you all are, can help teach patients more about managing their disease and any of the comorbidities that they may have and not know. And so I'm happy to have voted in favor for, and she's already gone, but the Nancy Gardner Sewell Medicare Multi-Cancer Early Detection Screening Coverage Act earlier this year, my dear friend Terry, and about her mother, which would help screening with cancer for Medicare patients to ensure that they have the best information about their health that they could. Now, Dr. Peters, you have done tons of work surrounding preventive care for chronic diseases. Can you speak to the clinical benefits of increasing education and screening so that patients are more informed about their options?
I think those are incredibly powerful tools because if you don't know you have a risk, you're not going to go find out and see if you can do anything about it. But education alone, in many areas, particularly with diabetes, isn't enough. You need to couple that with treatment, and treatment, frankly, should start with lifestyle. And so I see all of that as part and parcel of the same process. But education is necessary so people realize that they must do something. And I think that people go into these weird states of denial, and I'm not a psychologist, but they'll see family members who are blind or on dialysis, and they won't go get tested because they're too afraid to find out they have the same disease.
Right.
So I think it's you can get educated. We've done programs with the churches. We've done programs with the schools. There's all sorts of ways that you can get this out there.
I have to yield back my time. You all, thank you so much.
Did I make a comment?
Is he allowed to make a comment?
Quick.
Just quick, I think screening is really important. I think we wait too late. We're reactive, not proactive in medicine, and it's part of why I co-founded a company, Function Health, to allow people access to their own biological data without having to go through insurance or doctors. For $4.99, they get 110 biomarkers that track all these things, from kidney function to cardiovascular health to metabolic health, and diagnostics that are not done at your annual physical. And we're so behind the time. Senator Frist wrote an incredible paper in the New England Journal 20 years ago that talked about how long it takes from science to become clinical practice. And I think early screening and detection is important and it's essential, and I think this is something that should be looked at very carefully as something we can motivate our Medicare patients to do, as well as our citizens in general, to do early screening and detection.
Thank you so much. Thank you all. I yield back.